Have you ever reached for a handful of nuts, something you were told was good for your heart, good for your brain, maybe even good for aging without ever stopping to wonder what it might be quietly doing to your kidneys? Most Americans don't. And that's exactly why this matters. Because while you feel perfectly fine today, your kidneys may already be under silent attack, losing function without pain, without warning, and without a single symptom to alert you until real damage is already done. I'm Dr. Mark Ellis, and I need you to hear this carefully. Kidney damage does not start with dialysis. It doesn't start with swelling, and it doesn't start with fatigue. It starts years earlier in everyday habits that feel harmless. In fact, millions of older Americans are slowly losing kidney function right now, and nearly 9 out of 10 have absolutely no idea it's happening. You can lose up to 40% of your kidney function before routine blood tests even raise concern, and by the time your body starts sending signals, the damage is already well underway. And here's what makes this so dangerous. Many of the foods most aggressively marketed as healthy snacks in America are placing an invisible chemical burden on aging kidneys. Your kidneys don't care about food labels. They respond to minerals, toxins, and metabolic waste. Some foods quietly inflame and scar the tiny filters that keep you alive, while others can actively protect those filters and slow kidney aging when chosen wisely. That's why today I want you to stay with me until the very end. Because in the next few minutes, you're going to learn the exact difference between nuts that help protect your kidneys and nuts that may be accelerating kidney decline without you realizing it. This isn't about fear. It's about awareness, control, and giving your kidneys a real chance to keep you independent, energetic, and out of dialysis for as long as possible. Let's start with sunflower seeds, because this is where most people least expect real kidney protection to come from. When kidneys begin to age, the very first thing they lose is not filtration, but defense. The tiny filters inside your kidneys, called nephrons, are constantly under attack from oxidative stress caused by high blood pressure, blood sugar swings, medications, and simply getting older. And once those filters are damaged, they don't regenerate easily. That's where sunflower seeds quietly step in. Sunflower seeds are one of the richest natural sources of vitamin E, a fat-soluble antioxidant that acts like a protective shield around kidney cells. Vitamin E helps stabilize the outer membranes of nephrons, keeping them flexible instead of stiff and scarred. In studies involving older adults, higher vitamin E intake from whole foods has been associated with better estimated glomerular filtration rate, meaning the kidneys are able to clean the blood more efficiently with less strain. That matters because kidneys filter your blood hundreds of times a day, and even small improvements compound over time. I often think of a patient like Robert, a 67-year-old retired engineer who came in confused about why his creatinine kept creeping up despite eating healthy. When we look closer, his diet was heavy in nuts, marketed as heart healthy, but overloaded with minerals his kidneys could no longer manage. When he replaced those with small controlled portions of sunflower seeds along with other adjustments, his lab values stabilized within months. Not because sunflower seeds are magic, but because they reduced the daily chemical burden his kidneys were facing. Another reason sunflower seeds matter is circulation. Healthy kidneys depend on smooth, steady blood flow. Sunflower seeds contain magnesium and natural plant fats that help relax blood vessels, allowing blood to move through the kidneys with less pressure. Many seniors notice subtle changes when kidney circulation improves: less ankle swelling, better energy, and fewer afternoon crashes. Just as important, sunflower seeds are relatively low in phosphorus and potassium compared to many other nuts, which means they protect without overwhelming aging kidneys. The key, however, is restraint. 1 tablespoon a day is enough. More is not better. When eaten in moderation, sunflower seeds support kidney resilience instead of stressing it. But here's where things get tricky, because while sunflower seeds can protect aging kidneys, not all nuts play by the same rules. And some that look just as healthy on the surface may be doing the exact opposite beneath the label. But only knowing this isn't enough, because there's another factor far more dangerous than most people realize. And it's coming up next. After sunflower seeds, this is where things start to shift in a way most people never expect. Because kidney damage isn't only about antioxidants or circulation. Over time, one of the biggest enemies of aging kidneys is chronic inflammation, the kind that builds quietly day after day without pain or warning. And this is where macadamia nuts become surprisingly powerful. Macadamia nuts are different from most nuts in one critical way. They're rich in a rare type of fat called omega-7 fatty acids, which actively calm inflammation inside blood vessels and kidney tissue. As kidneys age, the tiny tubes inside them, the renal tubules, become less flexible. When inflammation stays high, those structures stiffen, scar, and lose efficiency. Omega-7 fats help keep cell membranes soft and resilient, allowing the kidneys to filter blood with less resistance and less internal damage. I remember a patient named Linda, a 70-year-old grandmother who did everything right. She avoided sugar, walked daily, and snacked on almonds and mixed nuts because she believed they were heart healthy. Yet her kidney labs slowly worsened every year. When we reviewed her diet, the issue wasn't excess calories, it was mineral overload. When she switched to small portions of macadamia nuts instead, something changed. Within 6 months, her creatinine stopped rising. Not dramatically, not magically, but it stopped moving in the wrong direction. And for aging kidneys, that's a win. Here's the science behind why that matters. Compared to most nuts, macadamia nuts contain extremely low levels of phosphorus and potassium, two minerals that aging kidneys struggle to clear. When these minerals accumulate, they increase pressure inside the kidney filters and accelerate scarring. By choosing macadamias, seniors get the benefits of healthy fats without forcing their kidneys into overdrive. Several nutrition studies in older adults have shown that diets higher in monounsaturated fats are linked to lower protein leakage in urine and more stable filtration rates over time. Macadamia nuts also help in another quiet but important way: blood sugar control. Sharp glucose spikes damage the small blood vessels that feed the kidneys. The fats in macadamia nuts slow digestion, reducing those spikes and protecting kidney circulation. For seniors with prediabetes or type 2 diabetes, this alone can significantly reduce long-term kidney stress. But portion size still matters. 5 to 6 macadamia nuts per day is enough. Eating them mid-morning after breakfast allows the fats to be absorbed gradually without overwhelming digestion. And storing them properly away from heat and light prevents oxidation that can turn healthy fats into inflammatory ones. So at this point, you might be thinking, you found the safest nut choice for aging kidneys. But the truth is, even the right fats aren't the full picture, because circulation plays a role just as powerful as inflammation. And there's one nut that supports kidney blood flow in a way most people completely overlook. But only knowing this isn't enough, because there's another factor far more dangerous than most people realize, and it's coming up next. After inflammation and mineral overload, there's one more factor that quietly determines how fast kidneys age, and it's something most people never think about until it's already gone: blood flow. Healthy kidneys are incredibly demanding organs. They need a steady, gentle supply of blood every minute of the day. But as we get older, the small blood vessels feeding the kidneys slowly stiffen and narrow, forcing the kidneys to filter blood under higher pressure. That constant strain accelerates wear, scarring, and long-term decline. This is where pecans deserve far more attention than they get. Pecans are a natural source of magnesium, a mineral that plays a critical role in relaxing blood vessels and improving circulation. When magnesium levels are adequate, blood flows more smoothly, pressure inside the kidney filters stays lower, and the kidneys can do their job with less effort. For aging kidneys, that difference is not small. It's the difference between slow, steady decline and long-term stability. I think of a man named Charles, a 72-year-old former teacher who struggled with rising blood pressure and borderline kidney function. He did everything his doctor told him: cut salt, walked daily, took his medications, yet his energy kept dropping. When we looked deeper, magnesium deficiency stood out. After introducing magnesium-rich foods like pecans in small controlled portions, something subtle but meaningful changed. His blood pressure readings became more stable, and his kidney labs stopped worsening. Again, not because pecans are a cure, but because they removed one more silent stressor his kidneys were fighting every day. Research backs this up. Large population studies in older adults have shown that higher dietary magnesium intake is associated with slower progression of chronic kidney disease and better estimated glomerular filtration rates. Magnesium also helps prevent abnormal calcium buildup in blood vessels and kidney tissue, a process called calcification that stiffens organs from the inside out. By supporting vessel flexibility, pecans help protect both the kidneys and the heart at the same time, which matters because these two organs rise and fall together. Pecans also contain powerful plant antioxidants called polyphenols. These compounds reduce low-grade inflammation inside blood vessels, further improving circulation and reducing pressure on kidney filters. And compared to many other nuts, pecans deliver these benefits without a heavy phosphorus load, making them gentler on aging kidneys when eaten responsibly. That last part is important. A small handful per day is enough. Pecans are dense and more is not better. When eaten slowly, chewed well, and stored properly to protect their natural oils, they act like a calming signal to the kidneys, telling them they don't have to fight so hard to keep up. At this point, it might feel reassuring. Antioxidants, anti-inflammatory fats, better circulation, all working together to support kidney health. But here's where the story takes a turn. Because for every nut that helps aging kidneys, there are others that quietly do the opposite, even while wearing a healthy label. But only knowing this isn't enough, because there's another factor far more dangerous than most people realize, and it's coming up next. Up to this point, everything we've talked about has been about protection, reducing inflammation, improving blood flow, and lowering the daily burden on aging kidneys. But this is where the conversation becomes uncomfortable, because one of the most commonly eaten healthy snacks in America does the exact opposite quietly and consistently. And that food is peanuts. Peanuts are everywhere. Peanut butter sandwiches, protein bars, snack bowls, even health trail mixes. Many older adults eat them almost daily without a second thought. The danger isn't obvious, and that's what makes it so risky. One of the biggest problems with peanuts is their susceptibility to aflatoxins, toxic compounds produced by mold that grows easily on peanuts during farming, storage, and transport. You can't see them. You can't smell them. But once consumed, they have to be filtered out of your blood, and that job falls heavily on your kidneys. I once worked with a patient named Harold, a 69-year-old retired truck driver who relied on peanut butter for quick energy. His diet looked simple and clean, yet his kidney labs kept drifting in the wrong direction. When peanuts were removed and replaced with lower-risk options, the inflammatory markers improved and his creatinine stabilized. Not overnight, not dramatically, but the silent stress was gone. That's often all aging kidneys need: less pressure, not more supplements. Beyond toxins, peanuts create another problem: mineral overload. They contain significant amounts of phosphorus, a mineral healthy kidneys can clear efficiently, but aging kidneys often cannot. When phosphorus builds up in the bloodstream, it disrupts calcium balance, pulling calcium out of bones and depositing it in soft tissues, including the kidneys and blood vessels. Over time, this leads to stiffness, scarring, and reduced filtration efficiency. The most dangerous part: high phosphorus rarely causes early symptoms. Damage accumulates quietly, lab value by lab value. Then there's sodium. Most peanut products are roasted in refined oils and heavily salted to improve taste and shelf life. Excess sodium causes fluid retention, raises blood pressure, and forces the kidneys to filter blood under higher pressure, much like running water through fragile pipes at full blast day after day. Even so-called natural peanut butter often contains added oils that promote inflammation, further stressing kidney tissue. Peanuts also encourage overconsumption. They're small, calorie-dense, and easy to eat mindlessly. That means repeated exposure to toxins, phosphorus, and sodium throughout the day. For seniors with early kidney decline, diabetes, or long-standing high blood pressure, this pattern quietly accelerates damage often before anyone realizes what's happening. This is why peanuts are so deceptive. They look harmless. They're familiar. They're marketed as healthy. But for aging kidneys, consistency matters more than intention. Choosing peanuts regularly can slowly increase creatinine and push kidney function in the wrong direction, even if everything else in your diet seems right. And here's the part most people don't expect. As problematic as peanuts can be, there's another popular seed that may be even more dangerous for kidney health, especially when it comes to stone formation and internal irritation. But only knowing this isn't enough, because there's another factor far more dangerous than most people realize, and it's coming up next. If peanuts quietly strain the kidneys through toxins and mineral overload, pumpkin seeds take a different but in many ways more painful path. This is where kidney damage can move from silent to sudden. Because pumpkin seeds are one of the most concentrated sources of oxalates in the modern diet, and aging kidneys are far less equipped to handle them than most people realize. Oxalates are plant compounds that bind with calcium in the body. When kidneys are young and strong, They're usually flushed out without issue. But as kidney filtration slows with age, oxalates begin to accumulate inside the urinary system. Over time, they form microscopic crystals that irritate kidney tissue from the inside. Those crystals don't announce themselves early. They build quietly, scratching the delicate lining of the kidney tubules until one day they cluster into stones, and that's when the pain becomes impossible to ignore. I remember a patient named Susan, a 66-year-old yoga instructor, who added pumpkin seeds to nearly every meal because she believed they were clean protein. She had no symptoms until one morning she woke up with severe flank pain that landed her in the emergency room. The diagnosis: kidney stones. When we reviewed her diet, pumpkin seeds stood out immediately. Not because she ate junk food, but because she trusted a food that didn't match her kidneys' changing needs. The science explains why this happens. Pumpkin seeds contain extremely high levels of oxalates along with concentrated phosphorus. For aging kidneys, that's a dangerous combination. Oxalates promote crystal formation, while excess phosphorus disrupts calcium balance, encouraging calcification inside kidney tissue and blood vessels. Studies have shown that individuals with reduced kidney function are significantly more vulnerable to oxalate accumulation, even at intake levels considered normal for younger adults. There's another issue most people overlook: portion size. Pumpkin seeds are small, dense, and easy to overeat. Just a few tablespoons can deliver a heavy oxalate and mineral load in one sitting. On top of that, pumpkin seeds are relatively high in protein. While protein is essential, aging kidneys are less efficient at clearing protein waste products. Regular high-protein snacking forces the kidneys to work harder, often pushing creatinine upward over time. What makes pumpkin seeds especially deceptive is their reputation. They're praised for hormones, heart health, and digestion, but oxalates are rarely mentioned on labels or in wellness blogs. Seniors often assume that if something is natural, it must be safe. Unfortunately, when it comes to kidney health, that assumption can be costly. At this point, you might be thinking, you know which foods to avoid. But there's one nut left, one that's widely considered a superfood that quietly combines mineral overload and long-term damage in a way few people ever suspect. But only knowing this isn't enough, because there's another factor far more dangerous than most people realize, and it's coming up next. After hearing about oxalates and kidney stones, many people feel a sense of relief and think, at least I don't eat pumpkin seeds. But this is where the real surprise often hits, because the next food on this list isn't obscure, isn't niche, and definitely isn't considered dangerous by most Americans. In fact, it's one of the most heavily promoted superfoods in the country, and that food is almonds. Almonds are everywhere. Breakfast bowls, smoothies, protein bars, almond milk, almond flour. Many seniors consume them daily, believing they're protecting their heart, managing weight, and aging well. The problem is not almonds themselves. The problem is how aging kidneys respond to the mineral load almonds deliver over time. Almonds are particularly high in phosphorus and potassium, two minerals that healthy kidneys handle with ease, but aging kidneys often cannot regulate efficiently. I think of a patient named Margaret, a 71-year-old woman who proudly told me she hadn't eaten junk food in years. Her breakfast was almond milk smoothies, her snacks were raw almonds, and her baking used almond flour. Yet her kidney labs kept worsening. When we added up her intake, almonds alone were supplying more phosphorus and potassium than her kidneys could safely clear. Once we reduced them, her lab values didn't just improve, they finally stopped declining. Here's why this happens. When phosphorus builds up in the blood, the body tries to maintain balance by pulling calcium from the bones. That calcium doesn't disappear. It gets deposited in soft tissues, including the kidneys and blood vessels, a process known as calcification. Calcified kidney tissue becomes stiff and inefficient, reducing filtration and accelerating long-term decline. This process is slow, silent, and painless until it isn't. Potassium adds another layer of stress. Elevated potassium forces the kidneys to work harder to excrete excess amounts, increasing internal pressure. In seniors who already consume potassium from fruits, vegetables, and other nuts, almonds can quietly tip the balance. Almonds also contain moderate levels of oxalates, which further increase the risk of crystal formation when filtration slows with age. What makes almonds especially deceptive is how normal they feel. They don't taste salty. They don't feel indulgent. They're framed as clean plant-based nutrition. But when consumed daily, especially in multiple forms like milk, flour, and snacks, They create a cumulative mineral burden that aging kidneys simply aren't built to handle anymore. This is the hard truth most people never hear. A food can be heart-healthy, plant-based, and still be kidney-hostile depending on your age and filtration capacity. For seniors, almonds are often not a single mistake, but a repeated one day after day, year after year, slowly pushing the kidneys towards scarring and loss of function. And now we arrive at the moment where everything comes together, because knowing which nuts help and which ones harm is only the surface. What truly determines your future kidney health is how these daily choices add up over time and whether they push you toward stability or toward dialysis. But only knowing this isn't enough, because there's one final truth that could determine whether your kidneys age gracefully or fail far sooner than expected. And it's coming up next. If there's one thing I hope you take away from this video, it's this: your kidneys are not failing you. They've been working quietly for you every single day, filtering your blood-balancing minerals and keeping your body alive, often without you ever noticing. And even if some damage has already begun, it's not too late to slow things down. Small, informed choices made consistently can still make a meaningful difference. You don't need extreme diets. You don't need fear. What you need is awareness. By choosing kidney-friendly foods, more often limiting the ones that quietly overload your system, and respecting how your body changes with age, you give your kidneys a chance to work with less strain and more stability. That alone can help preserve your energy, your independence, and your quality of life for years to come. If this information helped you, please take a moment to save this video so you can come back to it anytime you need a reminder. And consider subscribing to the channel and turning on notifications, because every week we share clear, science-based medical insights to help you protect your kidneys, manage creatinine, and care for your health in a way that actually fits real life. And before you go, I want you to know this: you're not alone in this journey. Many people are learning, adjusting, and improving their kidney health one step at a time, just like you. Your body is still listening. Every thoughtful choice you make today sends a signal of care to your kidneys, and over time, those signals add up. Take care of yourself, stay informed, and I'll see you in the next video.